Assalamu alaikum. I hope you can hear me.
Yes, we
Yeah, we
can.
can hear you. Thank you.
Assalamu alaikum. I'd like to thank you, Dr. Bala and Dr. Masood Umar, my good friend from many, many years. Thank you very much for inviting me and allowing me to share my experience over the last 2 decades regarding orthopedics and spine surgery in the US. I'd also like to say salam alaikum to Dean Adil. Adil was in the same medical school class as I was, the class of 1998. And it's always wonderful to see our whole class thrive and progress. So again, thank you, everyone. It's wonderful to make new connections and also connect again with old friends. So I have my slides. I wonder if you can bring my slides up. And I am chief of the division of spine surgery in orthopedics. My journey, and I was lucky to hear Dr. Shahid Shafi and everybody else in the first session to share what their journey was. My journey started with at the feet of Dr. Masood Umar, really. I was a medical student in a class of 98. Dr. Masood Umar was a great champion of orthopedics. He was someone who inspired me and continues to this day inspire me to repay the debt that he provided for me by giving me such an opportunity in Aga Khan. I knew that I wanted to train in the United States. Some of my family members were in the United States, and back then in 1998, that was sort of the pathway at Aga Khan University where we take our steps and then try to get residency in the United States. Most of my classmates went into internal medicine or general surgery. Orthopedics has always been a challenging specialty to get into in the United States. But I sort of felt that I couldn't do anything else. I had to. I was always focused and determined to make orthopedics my passion. So I started doing research. I knew I was young. I was 22 years old when I arrived to the country after we graduated medical school, and I had done an elective at Yale University. I had made a contact there who moved to the Hospital for Special Surgery in New York City by the time I graduated, and I committed that I would do at least 2 years of research and that I would apply for orthopedics after connections and research and publications, etc. Those 2 years became 4.5 years. And every time that I felt that I wanted to apply, I didn't think that I had the necessary CV to be able to compete with American graduates or other foreign graduates from other foreign countries. But finally, in 2004, I matched in orthopedic surgery at my #1 spot, which was UC Davis in Sacramento. I did the 6-year accelerated program where I took an extra year out after my second year to do research. And my research at HSS and my research at UC Davis was in spine surgery, on benchtop spine surgery, intervertebral disc regeneration repair, fracture healing, etc. I then chose to do a spine fellowship at Rush in Chicago. And the reasons were I felt that my training in orthopedics was fairly comprehensive at UC Davis, but I wanted additional training in areas of spine that I had not been exposed to in residency, like minimally invasive surgery, etc. So I did that at Rush, and then I was recruited after graduating from Rush to build the division of spine surgery at Ohio State. It was sort of a one-of-a-kind opportunity, fresh out of fellowship. I had the opportunity to either go back to California or to go into a completely different territory, unknown in Columbus at a level 1 academic center, to start as an assistant professor. And I chose that because I wanted to build something, and I've been here for the last 11 years. So why did I choose spine surgery? I think that's orthopedics is orthopedics. You have fractures, you have, sports, arthroscopy, joint replacement, reconstruction, tumors. But spine surgery sort of blends into two different specialties. And neurosurgery does spine, orthopedic surgery does spine. So why choose a specialty? For me, at least, it was my uncle was a neurosurgeon, is a neurosurgeon, and I saw from his perspective what spine looked like. When I was in residency and I had done all this research in spine, I really wanted to push the envelope with orthopedic spine because I had great mentors in research, in residency and fellowship, and like I mentioned, to this day as a medical student, Masood Umar is such a great mentor. I felt there was such a great depth and breadth of surgical cases in spine surgery. Oftentimes, when we enter orthopedics as a specialty, we get fascinated by fracture healing, big trauma, joint reconstruction, arthroplasty, hand surgery, or tumor surgery, especially the type of work that Masood Umar does. But for me, spine surgery, I felt there was such a breadth of cases. I could do adult spine, I can do pediatric spine, I can do tumor, trauma, infection, degenerative conditions, deformity, scoliosis. I can do it in a minimally invasive way. I can use current technologies with navigation and artificial intelligence or augmented reality, et cetera. So that to me was pushing the envelope of a very, very intriguing subspecialty in orthopedics. And there's a lot of innovation. Those of us who keep up with innovation in orthopedics, you can really see that the biologics or instrumentation, disc replacements, and basic science research is really unparalleled when you look at any other specialty or even any other major subspecialty. So what about orthopedic spine surgery fellowship? I can only speak for the fellowships now. I mean, obviously I'm probably, I'd say 16, 17 years out from when I did my residency. But when it comes to a fellowship, I can definitely say that your spine surgery fellowship from Pakistan, from anywhere, can definitely be done. We have more more spots open for spine surgery fellowship than applicants, but that trend is changing. Typically, we apply via the San Francisco Match Program. Most large fellowships, which will welcome foreign trained fellows because they want sort of to penetrate across the world, and it gives them more opportunity, especially to train academic spine fellows that then represent their name all around the globe. And sometimes the opposite is true. When there are newer fellowships, they will often match foreign trained fellowship applicants as their name starts developing. They want to at least fill the spot. Some of them can be ACGME accredited, some of them can be ACGME non-accredited, but that's a different situation. But my point is, and the point of this slide is that orthopedic surgery fellowship, spine surgery fellowship are incredibly possible and are available in the United States. Now, if I take, move the curtain around, I can tell you that it helps if the candidate has spent time in research or rotated at the target program. So, if you take some time, say take 1 year and email programs and say, I want to spend 1 year dedicated with research, and it can be paid or unpaid. It's also all different depending on the visa. I'll do a research program. I'll enter maybe a 2-year accelerated master's program, and that's something that we can, definitely discuss and talk about. You should talk with your fellowship institution. Then you can be absorbed into the clinical pathway and get a really, really prestigious spine surgery fellowship, because we're always looking for applicants who are going to be academic. We're going to push the specialty forward. The caveat here is, obviously, as we know, the world is changing. We know that, borders are changing, closing, opening, walls are being created, walls are being brought down. There are visa issues. Their type of visa issues are rampant. I have personally experienced that in my time 15, 17, 18 years ago. And then when I see new graduates from other countries coming through, new fellows coming through, I've seen that is an issue. So please be informed about your visa status, about what the home institution requires, and what the return to Pakistan or return to your home country may require. At Ohio State, and that was sort of the perspective that I think Dr. Umar wanted. We, in our spot, we have a accredited spine surgery fellowship. We matched 2 foreign trained fellows in year 1 and 2. We matched 2 highly ranked US applicants in year 3 and 4. This is our 4th year. We have a female spine fellow right now, and our program director is a female spine surgeon. And next year, the 5th year of our program, we have our #1 candidate. So you can see the evolution that now we probably in year 6, 7, 8 will probably be very hard pressed to absorb anyone unless they're really, really top quality candidates at our home institution. So what I've done over the last 3 years for our fellowship, we've had 3 foreign trained fellows that approached us and came to us and spent time with us. Vaibhav Kanawade was from India. He was my first spine surgical fellow. He graduated with distinction and he's in private practice in Texas right now. Nikhil Jain was my research fellow, and this is the pathway I was mentioning where you can spend time in research and then get absorbed into a clinical fellowship. Was a research fellow with me for 2 years and won multiple research awards at North American Spine Society, Scoliosis Research Society, all major research awards. He won as my fellow. He ended up becoming a spine surgical fellow at UVA in Charlottesville and just starting at Boston University. And he just interviewed, we got him in an interview call for a faculty position at Brigham and Women's and Harvard. So it can be done. We'll see where he lands, but I'm very confident he'll do great. And then my third, just recently graduated 2 years ago, fellow Varun, was from Delhi. Was a neurosurgical spine fellow first. He trained in orthopedics. Then he did my fellowship. All the faculty in our program absolutely were, proud of him, and we decided to absorb him. And he's starting as my partner in my division in December. So. Can it happen if you have the requisite qualities, if you have the requisite, credentials, and you have the desire to work and partner with academic institutions, you absolutely can get a good spine fellowship. So what would my recommendations be as I wrap up? Maximize your research potential wherever you are in your home institution. Talk to your mentors in residency. Your mentors in residency, more likely than not, will have connections all around the world. See if you can do some visitations while you're in residency. Take your boards early. Spots may open up while you're doing your residency or your research, and you may be able to get absorbed into a spine fellowship. Consider a longer commitment, especially if you're thinking of academia. Think of at least not just 1 year spine fellowship and then go back to your home institution. That may be what you want, as Dean Adil said. You may want to prioritize your family and your career and moving forward with your life. But if you want to do academia and you want to make that dent in the universe, as Adil said, then you may want to spend more time in research so you can develop a wider portfolio of opportunities that can propel your career forward. And your future direction can be as varied and challenging as you want to make it. You can be in a endowed chair of spine surgery someday as a foreign graduate, or you can go back home, or you can go into private practice and enjoy a wonderfully fulfilling life as all of us are attempting in our own way. So there are multiple resources available. Talk to your fellowship directors in the US, in England, in Singapore, in Japan, wherever you think you want to do your fellowship. Talk to colleagues that have gone through the same pathway. I found it very interesting as I sit from my vantage point and I see Vaibhav and Varun and Nikhil. A lot of people from India are constantly contacting them because they've seen what they've done, and he gives them they all give them great advice. Never forget that the most important thing is the quality of, it's all sequential. It's like building a pyramid. You have to have your basics strong. So wherever you are in your training right now, make sure you're doing the best you can at that moment. If you're doing a rotation in internal medicine, be the best you can be. If you're doing a rotation in something that you're not interested in at all, make sure you spend time and be the best you can. That will propel you to become the best intern, the best resident, and the best spine fellow. And that can, really make a huge difference to your career. You can look online for the SF Match and North American Spine Society Fellowship Directory. Good luck. I hope that I've kept this short and sweet as was requested by Dr. Umar and Dr. Obaga. Feel free to contact me with any questions or thoughts, and good luck. And thank you for the opportunity again to speak to everyone.
Thank you, Dr. Safdar. This was very beneficial for all, I hope, and thank you for sharing your contact email as well. We will have some questions for you at the end. So I'll go next with Dr. Abid Qureshi. And Dr. Abid, I'm sure he's here. He was among the first those who came online with us. Thank you very much. and he will tell us his successful orthopedic private practice in the United States. Dr. Abid Qureshi. Dr. Abid.
So it takes a village to raise a child, a very, very profound African proverb. It kind of sums how we all grow from medical students to interns, residents, and subsequently. But the most important thing in all of this is mentorship. My talk has three specific parts to it. First one would involve a little bit about myself, then a little bit about yourself, and finally conclusions. My name is Abid Qureshi. I am from the class of 1991. Dr. Masood and I myself were class fellows, and I practice orthopedic spine and trauma surgery. A little bit about my background. I graduated in 1991 from AKU. I had the opportunity to do elective rotations at the Mayo Clinic and Henry Ford Hospital when I was a fifth-year medical student. This paved the path for me to pursue after graduation. I came to the United States right after graduation and went through the match. I applied to about 40 orthopedic programs, 25 general surgery programs as backup. And match came out in 1992, about March. And I matched in general surgery. I didn't want to take that spot. It was a preliminary spot in New York City. I reached some of my mentors at Mayo Clinic and research position in orthopedic oncology. It was both clinical bench research in tumor suppressor genes. At Rush, I spent approximately 2 years doing bench research and clinical research with some of my mentors. And subsequently, I reapplied again through the match. Didn't match again matched in general surgery. And again, I mention this because I think that perseverance does play a role in all our careers. I stuck to my guns. And the following year, I applied again and I matched into orthopedics. So prior to that, I did a year of preliminary general surgery at Rush. And if you look at my career, most of it, I spent approximately 10 years at Rush. So my research was there, the general surgery program was there, my residency was there. And staying in a system with mentors helped. Subsequent to that, I did a trauma fellowship at Temple General Hospital and a spine surgery fellowship at Emory University. And since 2002, I've been in private practice. I interviewed for a few academic jobs, but a friend of mine convinced me to join his practice in the Bay Area. And I have been in the San Francisco Bay Area since 2002 and practice adult spine surgery. And don't take as much trauma call as of last year as I used to. Snapshot of US orthopedic surgeons, a study of the Opus review from 2018 indicated that the average age of orthopedic surgeon in the US was 56 years. There were total about 30,000 orthopedic surgeons. 60% were subspecialized in sports medicine, hand and joint replacement, which was the most common. Only 12% were in solo practice and 35% in group practice. So there is move towards consolidation of larger groups in private practice. Masood asked me to say a few things about a successful private practice. I think, like anything else, it takes a lot of hard work. The quality of your work speaks volumes for itself. I think attention to detail, discipline are key, and especially in surgical specialties, I think that attention to detail will set you apart from your other colleagues. Availability, developing a niche. For example, some of my colleagues do minimally invasive hips or anterior approach hips or minimally invasive knees, which kind of sets them from the rest of the people. And I am in a 30-man group, so we have all the subspecialties which of orthopedics other than pediatrics. word of mouth, website and online reviews, and we have a department which manages that. And also embrace change. 80% of orthopedics will be outpatient in 5 years, and those of us who don't embrace change will be irrelevant sooner or later. A little bit about the students. About 30 years ago, I was sitting in your shoes, and multiple questions, came to my mind. Can I get a residency in the US? Sure, you can. Should I go the fellowship route, like Safdar had mentioned? That is one route. What will it take? A lot of sweat and a lot of uncertainty. Get ready for a lot of refusals, denials. Scores do matter, but if they're average scores and you improve your resume with quality research, there's always room for you. Visa issues, what is my backup? I tell students who come across my way is that you can always do a general surgery residency and do a fellowship in hand, and you can still practice orthopedics. Multiple alumni resources are available. Most of all, just want to guarantee you this, that AKU has prepared you. In conclusion, now plan ahead, have a backup plan, find a mentor until you become one. Get ready for a lot of rejections. Be disciplined and focused, and enjoy the process. AKU has prepared you better than any other medical school in my mind, and I've been through multiple institutions in almost 30 years of this process. I have been very fortunate that I was accepted at AKU, and that was basically the cornerstone of my career. I thank you. If you have any questions, please feel free to contact me. Masood has all my information. Thank you.
Thank you very, very much, Dr. Quraishi. And I will give the screen and the mic to Dr. Shiraz Yunus to tell us the career in pediatric orthopedics, and maybe about his journey also from Lahore to Houston with some specific advices for our trainees. Dr. Shiraz.
Thank you, Dr. Masood, Omar, for inviting me to talk to this group about career planning, life beyond residency. It's been a while since I left the Al Khan Medical College, and it's an honor to talk to this group and to give something back. I apologize in advance. This meeting happens to be at a time when I'm on vacation with my family, so I had to record this presentation and not deliver it in person. Brief history of where my journey started and how I got to where I am today. Born in Chingola, Zambia, actually, which is a country in southern Africa. Moved back to Pakistan in elementary school. Did all of my schooling at Mason College in Lahore. I sat for my O-levels and A-levels at Eastern College. At that time, the equivalency system in Pakistan was such that even with the best of grades in A-levels, you didn't really meet the merit level for getting into any of the public medical schools. So my application to Al Khan University Medical College was my only option. It was a little risky to go down that route. A lot of my friends decided to switch paths from O-levels to FSC to get into medical schools to be able to meet the merits. But thankfully things worked out. I got into Al Khan, and probably one of the biggest stepping stones for me building my foundation in medicine prior to embarking on other journeys. So at Aga Khan, it was a pretty rigorous curriculum. At the time, it felt hard, but having moved to the U.S. and interacting with other graduates from medical schools in the U.S., I can say that I'm pretty proud to have graduated from Aga Khan. The foundations that I built at Aga Khan can compete with any of the medical schools across the world. My first exposure to orthopedics was probably in my 4th year. Prior to that, I did interact a little bit with the faculty in the orthopedic department. At that time, some of the instructors and residents, and I didn't really know what orthopedics was when I entered medical school. I come from a family of physicians, but none of them were in orthopedics. So my true first exposure to orthopedics was in my 4th year. People like Dr. Masood Umar, Dr. Pervez Hashmi, Dr. Haroon, Rashid, Dr. Riaz Hassan, Dr. Raza Asnan, who is actually a general surgeon, but at that time was pretty involved with the orthopedic faculty and residents. They all shaped my interest in orthopedics. It was one of the first rotations in my subspecialty rotations that I went through, and every time I go through a new rotation, I would be, well, let's see what else is out there. But my passion in pursuing orthopedics started in that 4th year, and in reality, it had more to do with the interaction with the excellent faculty, the residents, and the instructors that shaped that interest. And I still carry that passion with me today. The relationships that I built at that time stay with me to this day. I cherish these relationships. There are times when I reach out to people who have shaped my career, and it's very important that as graduating residents that you develop that relationship with your mentors and keep those relationships, because these are lifelong relationships that will continue to help you. I did have a very good idea of how competitive orthopedic residencies were abroad, so my initial intent was to pursue an orthopedic residency at the Aga Khan University Medical College. But that's where individuals like Dr. Masood Umar and Dr. Pervez Hashmi, who would have loved to have me stay over there and do my residency in orthopedics at Aga Khan University Medical College. But when they realized that I had an opportunity to pursue this abroad, they encouraged me to go down that path. And that was advice that really helped me. I did switch gears at that time and started looking into options abroad. I initially looked at residency programs in the UK, as well as residency programs in the US. Having family in the US, that's the path that I decided to follow. There were a lot of other things that played a role in that, but it started with the advice from the staff and the residents at Aga Khan. So moving to the US after graduation from medical school was by no means an easy decision. The biggest hurdle was the almost unsurmountable challenge of getting into an orthopedic residency. So even at the time that I moved to the US, in my mind, I had other backup plans of potentially pursuing a career in general surgery or some other surgical field. And not that I had any questions about what my number one choice was, but just being realistic. But on top of that, moving to a different country, into a medical system that is in many ways very different from the medical system in Pakistan, especially very different from a tiered medical system where public health plays the pivotal role, and tertiary centers are just referral centers. In addition, understanding the challenges both from a financial standpoint as well as a cultural challenge. These are all things that are expected, but what form you encounter them in is sometimes difficult to predict. So I was lucky enough to have some family in the US, so I at least had a place to stay in the beginning, but didn't have an income. Was in a new country with a new system, trying to get into a very competitive residency program. The credentials that I came in with were valid in my mind, but for institutions in the US, they were pretty much a degree from a developing country. So all of these challenges made it very difficult to make this decision. But being single, not having any visa limitations, allowed me to at least explore these options. And I made that move initially after graduation in 1999, and moved to California, where initially I took my step one, and then started looking for some research jobs to build up my resume. So one of the biggest challenges and actual understanding of how to go about getting into an orthopedic residency was finding a job to support myself while trying to do really well on the licensing exams. So in 2000, I tried for about 3 months to find a paid research job. Having no luck, I signed up to do research that was unfunded, was on a voluntary basis. I didn't have any income to support myself. I was living with friends, was relying on some funds from back home. But all of this in combination with the stress of having to take a licensing exam and do really well on it became very overwhelming very quickly. It was also a learning experience for me to understand the value of what I brought to the table when I was applying for jobs. One of the mistakes people make is they think that by overextending themselves, by volunteering themselves to do unpaid research, they're building up their CV to get into programs that they may want to get into. But unfortunately, unpaid research is not sustainable in the long run. And usually the quality of research projects that are given are not at the same caliber as someone who has a paid job. And it taught me to present myself in a way that got the other party to understand that I was bringing something of value to the table, which made it more realistic in order to support myself, but also be able to build up my resume to get into a residency program. So in 2000, I moved back temporarily to Lahore, and made sure that I did well on my step 2, and then moved back to the US to look for research jobs. I put this slide up because I wouldn't be where I am if it wasn't for my friends, my family, and my mentors who supported me during those difficult times when most of my medical school class was already in residency programs, and I was grabbing for straws, just trying to get a research job. So always remember the role that your family and friends play in where you are and what you do, and don't hesitate to rely on them in times of need. During that crisis time of my life, there were times where I wanted to give up everything, move back home and pursue a career back at home, or choose a different subspecialty. But it was the encouragement of my family, my friends, my mentors that kept me going and allowed me to pursue a career in orthopedics. And so I am indebted to all of them to get me past that difficult time. Whenever you're trying for a challenge that appears to be unsurmountable, there will be times of self-doubt, and it's your friends and family that will help you navigate those times. So a lot of people ask me how I was able to get into an orthopedic residency program, and I'll be perfectly honest, it's lining up all your ducks, having excellent scores in your licensing exams, having no visa issues, and on top of that, the prayers of my parents and a lot of luck. And with those, I think the year that I got into my orthopedic residency program, I only had 2 interviews, one at the institution where I was doing research, and the other one was an institution where the chairman was a foreign graduate, and none of the other programs even invited me for an interview. So there's a lot of these things that have to line up for people to get into a residency program, and as time has gone by, the process has gone more competitive. Fellowships have also gone more competitive, and so you have to keep those things in mind when you're going to that next step and applying for these positions. Even with all the things that were lined up, I still had a backup plan. I had done a year of prelim general surgery, and one of my last slides is about work ethic, and the work ethic that I showed in general surgery and my scores on their in-training exams put me at a spot where the program director had offered me a general surgery residency position had I not gone into orthopedics. So yes, all the things have to line up, but at the same time, don't spend an entire lifetime trying to pursue a goal that might not be realistic. Always have some form of a backup plan, or have other ideas in your bag that you might be able to use down the road. So alhamdulillah, I got into a residency program in Baylor College of Medicine in Houston.
I think most of the points they were covered. We thank him very much for helping us, although he could not be here. but we especially thank him for his time to prepare this presentation, especially for us. I will move now to Dr. Benjamin Miller to tell us about the challenges in orthopedic oncology as a career. Dr. Miller is my mentor, supervisor in the United States. I worked with him for 18 months, and till now I am affiliated with him at the University of Iowa in another maybe 6 months as a research fellow as well to complete the 2 years. He is my very good friend and family friend as well. And he has a special interest in orthopedic, global orthopedic oncology as well. Dr. Miller, screen, we can see your screen.
Okay. Assalamu alaikum. Nice to see everyone. Dr. Masood Umar, Dr. Abada, I know very well. Some others I've met. I had the pleasure of visiting Pakistan. It was 2 years ago. It seems like it was 20 years ago, but 2 years ago.
Yeah,
and
before the COVID, yeah.
got to visit Al Khan and go to Lahore and join in the Pakistan Orthopaedic Association meeting. So hopefully you are safe and healthy and we'll see each other soon. So as Abana said, I'll talk briefly about orthopedic oncology. So my situation will be a bit different and not terribly relevant, just given that I am from the US. So it's actually been quite interesting to hear all of the stories. And for me, it's always, it helps put things in perspective, because issues such as where you were born is nothing that you can control. And sometimes it's easier and sometimes it's harder. And I really have a lot of respect for everybody that I've heard so far. And everybody who's on this call, I just wish you good luck. And it is a harder road that you have than I had, and that's very true. So I cannot cover all of orthopedic oncology. Obviously, I will talk a little bit about big pictures. What is orthopedic oncology in terms of how is it different than other subspecialties? How would you think about orthopedic oncology as a career? And some issues with fellowship training and trying to determine what a career in orthopedic oncology should look like. So oncology is different than the rest of orthopedics. And the biggest distinction is that while a lot of orthopedic subspecialties will deal almost exclusively with issues of quality of life, how do you eradicate pain and restore function, take injured people back to a normal life, orthopedic oncology is one where our impact is to address a life-threatening diagnosis. So not necessarily a traumatic injury, but a cancer where if we don't do our job and do it well, the patient will surely die. So to me, that's the biggest distinction. It's different than the rest of orthopedics. We have patients that die. We have very difficult situations, tough calls, tough conversations, sad situations that you have to be able to deal with and go home to your family. So I do think that orthopedic oncology is something where you were either built to do it or you're not built to do it. And so the first step of it was just to be honest with yourself and to know, is this something that you're drawn to? Do you feel like you can handle perhaps a small child who has a metastatic cancer that's going to die? It's very difficult. And then you have to take care of the next patient and you have to go home to your family and you have to leave some of that at work. So keep that in mind. The operations are big. Some of them are small, but some of them are quite large. Some of them you get done with the operation and you say, I didn't know you could do that to a human being. And it's really remarkable that you can even do these things and people will live after them. The conditions we take care of are rare and unusual. This is difficult because in order to become good at something, you require a lot of repetition of the task. And if the diagnosis is rare, it's difficult to become very adept, both technically, but also to understand disease processes. And then it is multidisciplinary, which it takes a significant team to be able to do orthopedic oncology correctly. So you'll need to have a team, not just of yourself, but you need to have an institution that can handle very sick patients, and you need to have colleagues that can handle some of the other aspects of taking care of patients with cancer. One specific area is the challenges of operations. So orthopedic oncologists must be experts everywhere. So everywhere in the pelvis and the extremities. So this is different than many orthopedic specialties where you become experts in maybe one part of the body, but we have to be experts everywhere. A lot of the times, the issue is not just taking the tumor out, but it is what do you do now with the defect that you've left behind? And this is often the most complex form of managing people operatively, is not necessarily removing the tumor, but how are you going to restore function once the tumor is out? And this is something that the majority of our complications, the majority of our discussions that we have at national meetings is centered around this. How do you reconstruct bone defects? How do you reconstruct a soft tissue defect and provide the patient with a durable and functional extremity? Perioperative chemotherapy and radiation are very challenging to deal with. Both increase the risks of perioperative complications, the risk of infections. The patients on chemotherapy are unhealthy. It's more difficult to get them through a large surgical procedure. Radiation is a nightmare trying to operate through, and it can lead to many issues, even if you do a perfect job. And one thing that I'm continually, I've been doing this for many years, but one thing I'm continuing to learn is the personality of these tumors. What tumors act very aggressively, which ones are not so much. When can you maybe cut a corner and restore some function? When do you need to take more of a margin because the local recurrence is very high? And so this is something that it's difficult, and it only comes with experience. And because of the rarity of the tumors and the lack of repetitions of seeing these different things, that's a hard thing to learn. And again, I think over an entire career, perhaps you continue to learn the personality of these tumors. And then a part that is different than the actual taking care of patients. It's not about making the right decision or executing the right operation, but how do you create an orthopedic oncology practice? And there are some challenges that I think are quite unique that maybe you don't see in other surgical subspecialties or subspecialties in orthopedics. So one is that these conditions are rare, and the referral areas are often quite large. Now, if you are in the middle of a big city like Karachi, perhaps many people come from, within Karachi, but if you are in a smaller town, or if you are in a large referral area, patients will be traveling for very far away. And this has issues when it comes to expediting diagnosis and making a diagnosis early, where you can perhaps do a smaller surgery, or you can perhaps do an operation before the disease has metastasized. It has issues with follow-up. It has issues with chemotherapy and radiation. And these are, things that you do not have to deal with in other types of orthopedics. You should be at an institution that's big enough that you can have other services that can help you to take care of these people. So outside of surgery, you need a good medical oncologist. You need a good radiation oncologist. You need a good pathologist. You need to be able to make a diagnosis and then treat things with modalities other than surgery. When you're in the operating room, you need to have access to a vascular surgeon, to a surgical oncologist, to plastic surgeons. These are all things that if you were just on your own, you're going to have limitations to the things that you can do. And to take care of these people in an ideal situation, you really should have specialized colleagues in all these areas. So what this means is, ideally, to do orthopedic oncology, you need to be at a large institution with a big referral area with a lot of support. And finally, one of the challenges is to have an adequate volume of patients. So, many of these subspecialties, you don't have to worry. There's more patients than you could ever treat on your own. But in orthopedic oncology, it can be challenging because it's so rare to build a practice full of patients with musculoskeletal tumors. So this is a map of the United States. This is, as of about 3 years ago, these are all of the people who are in the Musculoskeletal Tumor Society. So this is the main tumor society in America. And you can see from this map that the orthopedic oncologists, there are actually not very many. You could count on this map each individual dot. And this is different from the 20,000 or 30,000 orthopedic surgeons that reside in the United States. You can count the dots of the orthopedic oncologists. And then you can see that there are areas that are vastly uncovered. And it's the areas that do not have a lot of population. But if you see in the center, kind of upper north part of the country, it's very rural. And there are no orthopedic oncologists for several states. So this is one where travel is an issue. And how do you find these people early, and how do you treat them? And you'll notice that most of the orthopedic oncologists are located in population centers, which certainly makes sense. Where there's more people, there's going to be more coverage. If you look at the numbers, and I know the most about Pakistan, but this applies to other countries as well. So in the US, we have a little over 200 orthopedic oncologists, and there's about 330 million people in the US. So that turns into about one surgeon per 1.5 million people or so. In Pakistan, I think we had estimated that there were 10 orthopedic oncologists. This may be off by a few, and there's 220 million people. So Pakistan is a large country, not very many people trained in orthopedic oncology. And this, if the numbers are correct or close to correct, we can say there's one surgeon per 22 million people. And in general, I would say a rule of thumb that holds fairly accurate is one orthopedic oncologist can serve 3 million people. So the tumors are rare, and it takes 3 million people to support one. So you can see, if you look at a country like the United States and a country like Pakistan, we have challenges, but they're different. So in the United States, the challenge is almost that we have too many, which sounds very strange because there's only 200 people, right? Which doesn't seem like a whole lot, but that's almost too many for the United States. So the issue that we have in the United States is, are we training too many orthopedic oncologists? Are people going to lose their skills? Are they not going to be able to have enough patients to be able to learn the personality of these tumors, you know, and get the reputations that you need, that we know you need to be skilled and be excellent at something. Pakistan, the situation is different. There are just not enough orthopedic oncologists. This is not enough. One orthopedic oncologist for 22 million people. And this leads into problems now with people being treated poorly or late or not at all. So the two countries have different challenges. And if I were to look at Pakistan, and this is something I have a relationship with people in Pakistan. My wife is actually half Pakistani. Her father immigrated, so I have a affinity for the country. And one of the things that I've worked with Dr. Masood and Zishan Khan and Abada with is to figure out, you know, how can we help address some of the limitations of orthopedic oncology in Pakistan. And I think we all agree that the key is training. And we've talked about that quite a bit now. And there's some opportunities within Pakistan, which is great. And there are opportunities from outside of Pakistan. But we know that if you're able to train people specifically in orthopedic oncology, then you can build this knowledge and you can build experience. And it can solve the problem of not enough experts. And so if you train more people and they can go to different large hospitals and tertiary care centers throughout the country, well, then the referral patterns become easier. You become closer to people that need your help. It becomes not as difficult to travel there. People can start going to experts rather than going to people that don't really know what they're doing and should not be taking care of sarcoma and other musculoskeletal tumors. And you would hope that you would see improvement in things like survival, limitation of local recurrence, and function. And then the last thing that the training people in fellowship allows is the person who now has completed the fellowship can become the teacher. And there was a slide earlier, you know, find a mentor until you become the mentor, right? I think that's a great way to put it. If you go through a fellowship, then when you're done, now you become the expert. Now you can train somebody else and you can pass that knowledge along. So I do want to end because there are many trainees on discussing an opportunity I have. I'm at the University of Iowa in America. And this is, as Abada said, he came and did a fellowship with me, spent 18 months. We had a great time and you know, we learned a lot from each other, I think. And so I've established a fellowship, and as I said, I think the United States has an issue with orthopedic oncology that we have too many. So this fellowship, actually, US applicants are not welcome. This is for international applicants. A one-year clinical fellowship. I'm in the midst of having it accredited by our tumor society. We'll participate in the match. If you are interested in it, you can just Google Orthopedic Oncology Fellowship. This is my email and my fellowship coordinator's email. The criteria that we have for it, I would like people to be from an area, a country of that has a need in orthopedic oncology. Pakistan certainly qualifies, other places qualify as well. Fluency in English is a requirement. It's difficult to teach and to learn if you're not fluent in the language in which the education is being done. And ideally, there is a plan to return to your home country to make things better. So that's maybe the distinction between the other talks that we've had is, you know, for me, what I'd like to do is recognize the privilege that I've had by, like I said, no hard work of my own. I just happened to be born in the United States, and some more doors were open for me. I look at this fellowship as an opportunity to you know, maybe lend a hand in different areas of the country where finding that specialization is a bit more difficult. It was a great program today. I really enjoyed listening to all the talks, and thank you again, Dr. Obata, Dr. Masood Umar, and I'll stick around for any questions at the end.
Thank you very much, Dr. Mullah. It was very informative. And we will get back to the questions just after another two speakers. Dr. John Barlow, I can see you. Thank you for joining us. And Dr. John is from Mayo Clinic, and he will tell us about the opportunities within Mayo Clinic and the USA in general.
Beautiful. Thanks so much. Hopefully you guys can hear me, and I'm excited to join you. Obviously, this is just
hear you and see your slides. Thank you very much.
Perfect. This is just an incredible symposium that you put together, and you've got a lot of resources. Echoing what Dr. Miller said, I think my background, I grew up in the United States and did my training through undergrad and medical school at the University of Wisconsin and then Mayo Clinic. And that pathway is pretty straightforward and well-defined. And I think certainly each of you for pathways in the United States, but also internationally, it's a much longer road. And you have tremendous access to resources here for people who've been through this before and done it different ways. I'm not that person, but certainly I get to see people from lots of different backgrounds. And I wanted to give my my perspective on it. I was recommended for this role because I'm the program director of the orthopedic surgery residency, and Frank Sim is a mentor of mine and a friend of mine, and certainly put me through the paces as an intern when I was on his service at Mayo Clinic. So I would also like to shout out to Safdar Khan, who's a good friend from Ohio State, where I started my career a few years ago. And we had some dinners together and spent some time together. And he's an amazing guy and certainly an incredible resource for each of you as students. The disclaimers, I'd like to cover a few things. One thing is just to briefly discuss some of the options for practice at Mayo Clinic. But then one of the things that I have been asked to do several times is to discuss how to be successful in your first few years of practice. This could be your first few years as a fellow in the United States, but also as you join practices around the world. The disclaimer or disclosure is that I changed positions after my third year practice. I worked with Safdar Khan at Ohio State, and then I moved to Mayo Clinic. So these are my own personal opinions. First of all, Mayo Clinic opportunities. We certainly have a number of fellowships at Mayo Clinic. They're all quite competitive, but I think they're open to both national and international applicants. We have 3 hip and knee reconstruction fellowships, 2 shoulder and elbow fellows per year. And that's my primary area of interest is shoulder and elbow. And I also do some trauma surgery. 4 hand surgery fellowships, 1 musculoskeletal oncology fellow, 1 sports medicine fellow, and 2 spine fellowships. We also have 2 other locations across the country in Arizona and Florida. We have 1 adult reconstruction position in Arizona and 1 sports medicine position in Arizona. And we have 1 hip and knee reconstruction position in Florida. I should make mention that we also have our residency program, which is 60 to 65 residents. We take 12 per year residents. And obviously, as you all know, and I've been following the chat and some of the conversations, it's just extremely competitive. Last year, for our 12 positions, we had 860 applications. So it's a competitive process and one that we continue to review and update each year. In addition, we also have career opportunities in what we call our Mayo Clinic Health System. We have about 50 orthopedic surgeons, and this was before I became the program director. I oversaw this group, and it's surgeons in general orthopedic practice, but also some subspecialists throughout Minnesota, Wisconsin, and Iowa around the Mayo Clinic. So a broad net of surgeons and clinicians around the area. As I think about jobs, and certainly it would be, I have never been to Pakistan. As when we transition away from the virtual world, Safdar Khan already told me he's going to be my tour guide around Pakistan, and I can come visit and do it in person after COVID. But as we look at jobs in the United States, I think there's a lot of different things that kind of weigh into your mind about how to choose a job, what is important to you. And for me, it really came down to the organization that I wanted to join. I wanted to join an academic organization. And I wanted the practice mix to be one that I thought I could be happy with. So for me, that was a shoulder and elbow intensive practice. And for each of us, that leads us in different ways. Other people might have different priorities. They might say location is number one. They might say the amount of money they get paid is number one. And I think everybody is a little bit different in that regard. This process, I think, is complex in terms of finding jobs and finding positions. Obviously, with visas and otherwise, it's increasingly complicated. And I think that's where you really need to lean on your mentors and people who've been through the process before to be able to navigate the process as effectively as possible. For us, I think job timing really comes down to starting to reach out and make connections as you progress through your training. The more certainty you have about what your final training pathway will be, the more likely it is to be able to gain credibility and employment. So for me and for a lot of our trainees, it's after you know where your fellowship is going to be, then you can say, okay, I know I'm going to be an Ohio State trained spine surgeon, and now I can really become an asset to a group or a practice. Resources, letters, and cold calls are sometimes effective, or emails. I think ultimately most of this world, it's a small world, it's a global world, is connections through residency, faculty, fellowship, and friendships between surgeons across the world. And I think as you do interviews, it really needs to be a two-way street. I think sometimes transparency is hard, and you want to say to a job or employer what they want to hear. And I think sometimes that can be a setup for disappointment down the road as you progress. So I think transparency is important, especially early in the process. The other part about it is oftentimes thinking about sacrifices that you're making. So we heard in one of the previous discussions about taking unpaid internships or research things. And this is all the wins and losses. And you say, well, that is a necessary sacrifice that I need to take to be able to get where I want to go. And you just have to weigh what the wins look like compared to the losses in your life and the timing in your life. And the wins may be, it may be that one strong win or the opportunity for exposure to a certain provider or to a certain mentor or a certain fellowship is important enough to make a lot of sacrifices in your life. And I think you have to weigh that with your family, with yourself, and with your mentors locally as well. I think it's really important to begin communication before you arrive at your first job or your first research opportunity, and remember what your role is there and to try and do your job the best you possibly can. So it's easy to come somewhere and believe that they should be happy to have you. And I think everybody in every location, I think you need to come in with a chip on your shoulder and prove that you deserve to be there. Perception really becomes the reality of where you go. And I think it's easy to lose trust. And I think it takes a long time to build it. So that's really hard work, dedication, and integrity with the positions. We heard that as a common theme from some of the other discussions that we heard this morning. Integrity through the process. And you'd rather have integrity than perfection. So finding ways of doing it the right way and honestly is really important as you go through the process. The other thing that I think is critical is having proactive communication. I think this is where most relationships in first jobs or in jobs in general break down. Identify key members in your organization and have direct communication with them by whatever mechanisms necessary. Sometimes those happen naturally. In most cases, you have to find a way to make that happen for you. So I think about my job that I took at Ohio State, and one of the key role models there was Julie Bishop, who was one of my senior partners. And I found ways of engaging with her and sharing cases and talking with her so that she would know me and be able to advocate for me. I also think that communication in the modern age, we do a lot of texting or emailing. And I think when you have nuanced conversation, there's no substitute for in-person communication. So if it's going to be a challenging conversation, do that in person. If you can't make that happen, a telephone call is much better than an email where you're trying to sort of parse out difficult situations. And then I think obviously the most important part is excellent patient care. At Mayo Clinic, we talk about the needs of the patient coming first. And the way that you really establish yourself is by being an outstanding provider of patient care in whatever opportunities you have. That comes down to bedside manner, comes down to having really good indications for surgery. Sometimes people want to get busy before they get good. And I think being really careful about doing the right thing for your patients is important. Becoming efficient in your patient flow and taking care of patients. And then also here in particular, and I obviously don't know the nuances of the Pakistani medical system, but having good communication with the people who are sending patients to you and following your patients and other providers, both nationally and internationally, is critically important to your long-term success. I think ultimately then it comes down to also building a differentiated practice. Subspecialization is important for us here, and defining a niche no matter where you are and what the character of your practice looks like. You want to provide a really high level of service to each of your patients, and that's building your personal brand. And in practice, that's building your brand, and in research, that's building your brand of what product you're going to provide to your research mentors. And as they've talked about several times, there's really no unrealistic goals. There's only unrealistic timelines. So for the most part, you can make your dreams happen. Sometimes it just takes a lot longer than what you'd like. Building your team is important as you go forward. Obviously, finding and surrounding yourself with people that you like to work with, and you can understand yourself and how you work with others is critically important. And I think expecting excellence of those around you is something that is critically important to us here at Mayo Clinic, but also likely in your local environment. And then I think the final question, and this is true for all of us, and it's true as you consider your options going forward, is thinking about how you evaluate where you are, your station, and what makes you happy. I think in many cases, we evaluate our life on a day-to-day basis, and we have a bad day and say, gosh, I need to go somewhere else. Or, you talk about a research position or otherwise in the United States, and you say, I don't know what I'm doing here. But I think you have to really set up your timelines in sort of discrete periods. So what I tell everybody is after you take your first job, wait until after 2 years to make a decision. We don't need to make decisions about long-term priorities on a day-to-day basis. And also recognize and evaluate opportunities that you have in your life. Recognize that it's easy to think that there's better opportunities elsewhere, but everybody's got challenges in their life. And just be thoughtful about what you're sacrificing and what decisions you're making, because it's easy to think that the grass is greener somewhere else. And in many cases, you're in a good position in your current location. And then the final thing people oftentimes ask about, which I have just no ability to control, is work-life balance. I'm here giving this talk to you guys on vacation at my family's lake house. And I think we all just have challenges here. And for me, work-life balance is just loving what you do, loving those people around you. I love orthopedic surgery. So it's easy to do these things and engage and be a part of it, but that makes it a lot easier. And then that's clear communication with your spouse and your family about what you do. It's also about having a long-term outlook. So this is a career and a lifestyle. So you have to make it work with the rest of your life. Thanks so much for having me. I hope some portions of that were helpful for you. Obviously, I don't know the detailed niches of Pakistani practice, but I'm happy to join you and be a part of it.
It must be beneficial. Yes, thank you very much for your time. I will move to our speaker, Dr. Senator Saud Anwar, and he will tell us the journey or the successful physician and politician. Is this an option? Dr. Senator Saud. Thank you.
Thank you so much, Dr. Obada Hassan, and thank you, Masood, Omar. I want everybody to know what an amazing friend and surgeon Masood is. And I see my other friends and colleagues over here as well, which includes Dr. Shahid Shafi. And I also wanted to say hello to Dr. Abid Qureshi, who are Masood and Abid are my classmates. So look, I have taken a different path. I'm a pulmonologist and an intensivist. So I'm still practicing pulmonary and critical care in the United States in Connecticut. And and I'm currently also serving as the chair of Department of Medicine in one of the two of the hospitals over here. In this process, when we are practicing our specialty, all of us go into a field because we hopefully want to make a difference. And as we try to make a difference, you recognize the reality that we are limited in some levels in our abilities to make a difference based on how we practice. So as an intensivist, I take care of patients who are in the ICU, whether they have orthopedic surgery or a complication or a bleed or trauma or cancer or COPD, emphysema, all of the challenges that people have. So as I take care of them, I look at it as a symptom of something that is wrong in the society. So that's where I use my public health hat and say, okay, what policies are leading for the people to come to the intensive care unit? What policies or failures in the outpatient setting are resulting in individuals not being able to have a full life the way they need to? And then I recognize that there are policy areas and opportunities that we have to explore. And that journey started to take me from medicine, which I remain practicing full-time pulmonologist and intensivist. But as I do that, I actually became a town council member. And the other part about going in policy arena is that when you are a professional, you are not afraid because when you stand up for the truth, when you are not being, nobody can buy you, if you will, then you become more effective. Because if politics is your profession, it's not a straightforward path wherever in the world you are. So with that in mind, I just want to share that I became a town council member, and I was fortunate enough that the people selected me to serve as the mayor of the town as well. And the policies in the town were such that we were able to show that we were able to have a healthier town. The lifespan of the people in the community started to improve because we were able to create ways of people to live healthy, eat healthy, and have an environment which was much more safer in many ways. And these are policy-based decisions. You'd be surprised how many policies are impacting what we end up seeing. This journey took me to the point that I was fortunate to be considered worthy of serving as a state senator. I'm of Pakistani heritage, a graduate of Aga Khan University, and this journey to try and fix things has led me to get to the point where I'm now serving as the chair of Children's Committee, vice chair of Public Health Committee, Insurance and Real Estate Committee, as well as Housing, and then also on Appropriations Committee, Planning and Development, and Judiciary. Literally have my hands into so many different aspects, but my hat that I wear of a physician is helping me guide the policies that are going to try and prevent diseases, but also identify them early and then hopefully be able to treat them in a manner which is easily accessible to people. There are health inequities in every society. In Pakistan, there are health inequities. I was trained there. I know that people who can afford have a slightly better chance of getting different care as opposed to the people who cannot afford. And then that's been part of the challenge. We have similar situation in the United States. I'm trying to see how we can make it even so the opportunities are much easier for people to get life, quality of life is better, but also get the same level of healthcare if possible. And then so that journey remains at this time, but you can also pick battles. So I've been behind a few of the big battles in my community where I serve. I started as a town council member, and I said that the pharmacies should not be selling cigarettes. That journey and that fight took me to fighting with the tobacco industry and the pharmaceutical industry. CVS is one of the multi-billion-dollar companies. I took them on, and after conversations a few years ago, CVS said that they will stop selling cigarettes in the entire world wherever their policies are, and they took a loss of $2 billion, but they at least have stopped selling cigarettes. Why that is the case and important to me, when you are selling cigarettes and they're next to Tylenol and your nutritional supplements, that normalizes, it's point of sales marketing. We want to protect the next generation from being exposed to tobacco and products. We have actually also changed the age group where tobacco and vaping products can be used. I'm trying to ban vaping products right now. That's another battle. It's a multi-billion-dollar industry. Juul hates me. Insurance industries hate me. The number of my enemies are increasing, but which is a good thing because all of these enemies that I'm making, they are actually causing health-related issues to the children and the current generation of individuals, but also to the minorities in the state where I live. So all I want to just summarize in saying is that this is one way to be able to make a difference as orthopedic surgeons in future. While you're doing what you're doing, you will come across recognition that a lot of injuries that you're managing and taking care of, they're preventable. And those preventable injuries will require policy changes, educational effort. But educational effort only goes so far. You need to have complete investment in the policy end, and that's where you actually take care of it. So if you educate people to wear seat belts, yeah, some people will say wear seat belts. But when you get a ticket if you don't wear your seat belt, I'm not driving right now, so I'm not wearing one. But I'll tell you, that's what the laws are able to change the behavior. And then when you can change the behavior of individuals through policies, you're going to make so many changes in life and then save lives going forward. So this is again another thing in the beautiful conversations that you're all having an opportunity to listen to is know that in this path, it's not a straight path. In Pakistan, I was trained in Pakistan. We were kept with a mindset: you have to do medicine by a certain age, you have to do specialty by a certain age, you should do such and such by a certain point. Everything had to be linear and cookie cutter. And recognize that no, it should not be linear, it should not be cookie cutter. You need to be able to look at what your skills are and how you can give back to the most to the community. So I'll stop here. Thank you for this opportunity, and thank you, Masood, for having me speak today. Thank you.
Thank you very much. I appreciate all of our speakers. In the discussion, maybe I'll just have one or two questions that I received from most, and we can start. If like, what do you think is? Yeah. So question is like of two parts. The same questions that we asked in the first session is about any specific advices you would give to your 35-year-old self at that. And second is, what do you think is the best payback to your motherland?
I think these are good questions. I think that, I mean, I do young medical students and surgeons. My advice is that look for good mentors. There are plenty of people like Dr. Miller, Dr. Barlow, Dr. Masood, who are willing to give back in various shapes and forms. And so in that process, they live on. I think that mentorship is extremely important, and that is what we are willing to give our time and efforts to help young surgeons. And for the young surgeons, I mean, it is not impossible to follow a career pathway and training in the United States. It just takes a lot of time and patience. I think doing cutting edge research, maybe getting a PhD in biomechanics or any subspecialties, biochemistry, I mean, that would put you on a pedestal which would separate you from rest of the people. Being a foreign medical graduate, you are at the bottom of the food chain. And the sooner you realize this, that you have to be much better than the other colleagues to get to where somebody else has to get to. So hard work, discipline, focus, basic principles, I think will help you get where you want to get to.
Thank you, Dr. Miller. If you have any specific advices for the youngsters, also like me, already was a mentor and telling many advices, but also for our audience, those who are entering their career, those who are interested in the unaccredited fellowships in the USA also. And
yeah, I think just a general piece of advice would be, I think it's very clear that the path is not necessarily going to be straightforward. There may be different opportunities that you wish you had that don't pan out, or maybe an opportunity that you weren't looking for that come along. So I think the challenge there is just when you're presented with something, think about how maybe a challenge or something that appears negative, how can you turn that into an opportunity? And perhaps it will push you in a way that you didn't necessarily think you were going to go to initially, but you may end up just where you wanted to be, or a place that you didn't know you wanted to be until you're there and you look back and you say, this is the way that it had to happen.
From Dr. Miller, I'll ask one more question, and Dr. Jonah as well, the same. If one of the guys, they ask this question, that if there will be specific advices, maybe now not for the juniors, but those who are at a leadership position from our seniors and faculty here in Pakistan, the seniors who are trained. Do you have any like recommendation maybe or advice to them about these fellowships and maybe the post-fellowship seats or programs?
Yeah, I mean, I think there's no age limit on fellowships, right? Or additional training. I think you look at, I think initially when you're younger, you look at where you want your career to be, right? And you need a lot of education opportunities for that. And then as you get older, sometimes I'll say like, I don't need any more letters behind my name, right? Like I don't need to do a degree just to have the degree. You start to think about, well, where am I deficient as a leader or as a surgeon or as a doctor or as a citizen? And what experiences do I need to create for myself in order to gain the skills that I need to be more effective in the way that you want to be? So I would say specifically for maybe somebody that's done with residency or has been in practice for a few years, there's no limitations on training. Life happens until you die, right? So you're always going to learn and experience new things. And so there is some challenge to keep the flexibility of pursuing whatever your interest is. And then I think also, one thing about us who have pursued medical training is we're very used to change. We don't do the same thing for 30 years. We do something for 2 years or 4 years or 5 years, and we're ready for something new. And I think that's just how we're built, how our mind is wired. So I also think, as you get further on in your career, interests may change and something may come up that you didn't expect, and you owe it to yourself to pursue that. So, so I think, specifically like, for my fellowship, for these fellowships in the United States and the opportunities, there's no limit on it. We're looking for a good story, and we're looking for somebody whose heart and mind is in the right place.
Yeah. Yes, and we hope also such programs will increase, which are focusing on the international global type of global surgery, international fellowships. Dr. John, maybe if any specific advice in 1-2 sentences, if you can.
Yeah, I think that I would echo some of that previous advice. And I think if I were to really give my best advice, and it's to my residents, but all residents across the world, is just to be as successful as you can in the location that you're in. And if you, sometimes we think, well, this will align me for this fellowship or another fellowship. And being at the absolute top of each program that you're at is critically important. And I think the secondary part of that is set goals over which you control portions of it. So if you say my goal is to be the #1 resident in my residency program, to put myself in position to get a fellowship in the United States, that may or may not happen, but you'll be unlikely to be disappointed that you positioned yourself to do that and to succeed at that very high level. And then the final part is just working through the mentor and friend pathway, and not taking it personally if the system doesn't work out in your favor, because a lot of these things are not about the individual human being that's trying to get the fellowship. It's about connections and time. And if you can get a foot in the door, wedge your foot in that door, because it is a long road to be a foreign medical graduate. And certainly we want superstars at Mayo Clinic and in the orthopedic community, but it's just a challenging road.
Thank you very much. With Dr. Senator Saud, I would like also to have a few sentences maybe from you for our youngsters, those who are starting their career, some advices, and some specific questions from you as a politician, Senate, and a physician who is very much familiar with the health system in Pakistan as well. The direct question maybe will be, what do you think? Because here we have, like, going out for fellowships maybe is difficult. And currently, at the same time, we have less fellowship seats, post-fellowship seats, due to the budget and financial issues of Pakistan Orthopaedic Association and the CPSP. So how to indulge our leadership, policymakers, in increasing their maybe collaboration with us to increase these seats and the financial stipends for the fellows? Is there any specific advice you can give us? Then I think we proceed for the last part of our program, the last session, opportunities in the United Kingdom and Ireland. We thank Dr. Munawar Shah to join us, and he will be telling us about the career planning in the United Kingdom and what are the changes after the Brexit.
Before I start, I should thank Masood Saab for giving me the opportunity. I know him from a little while, and we both have the same ambition of teaching people in Pakistan and trying to make education easily accessible. And I also was here earlier part of the talk, and I saw Sir Khan Khani Saab do a nice talk and kind of mentioned me. So for all of you who don't know me, I've been educating and teaching in Pakistan from here for the last maybe 7 years. I've helped people pass exam or try my best to do it. And I've even had the first fellowship from the POA to be sent to me. So I am well within my capabilities or whatever to get education promoted. But I will give you my experience of what's happening in England, and hopefully all is not gloom. Yeah, okay. So this slide says a lot about me. I don't live in Pakistan, but it lives in me, and I try my best to sort things out for you guys. What my talk today is career choices in the UK, and it's all about putting pieces together, basically trying to make sure, like everybody said before me and all these team guys before me, that you have to make yourself available first and then be the best me there is, and maybe at least be 4 times better than the average guy, and at least 3 times better than where you're applying. So if you're going to America or to UK, you should be at least 4 times better before you can be considered or noticed. So the thing in Pakistan in the myth is, MBBS is everything. Once you've got into medical school, everything will be fine. That's not true. Okay, the reality is you have to work hard, you have to study hard, you have to build a career, and you have to go through exams and assessment all your life. So by the time you come out on the other side of medical school, you are a very different person from where you started. Okay. And then you have to career plan, and you have to look at, getting a job, making money, look for family to support, and then also to improve your career and to get into something that you want to do. And I think one of the statements I heard from one of the speakers before is, you have to love what you do, and if you don't love it, there's no point. Okay. So let me welcome you to the world of medicine. I believe all of you guys that are here are into orthopedics in a big way, and all of you guys are at least your fellowship, post-fellowship trained. Am I correct in assuming that, Bada? No. Okay. So
we got this. Yes.
They're all FCPS passed, isn't it? Yeah. Okay, so these are all jigsaw puzzles, and these are all combined together will make what you want to be a successful career in orthopedics. You have to have interest, you have to have goals, you have to have scopes, you have to fulfill your requirements, you have to prepare, you have to have the skill, and then you have to plan. Okay, so planning is very important. You need to know what you want to make yourself. You need to have the specific skills, and you want to be guided by your peers or mentors to tell you what skills you need to work with. Okay, and I also agree with the speakers from before that you don't have to have one particular goal in life. You have to play it safe, and therefore have 2 or 3 options. If the first one doesn't work, you can fall back on something else. Okay, and you need to evaluate your interest. You need to know what field suits you better, and what challenges are you able to take for that particular field you want to be in. And you need to know what skills you need to have or develop before you can continue in that skill. I mean, I've heard a politician talk about career planning. I've also heard a CEO or chief executive officer. So there are various options for you guys to fill in. Not everybody can be or end up being an orthopedic surgeon, because as we know, statistics and tells you that there are not many fields and scopes for these to happen for you guys. Okay. So you don't have to be skillful, but you have to be noticed. And this is, if you know this guy has to be noticed for what he's just done, like, so you have to develop that kind of capabilities, and your skills should be there. I mean, he plays football, but his skills is he can balance Pepsi bottle on Pepsi bottles and get some money for it, like I said, yeah. We need to know what we want to achieve from life. The life between student postgraduate and real life is a big challenge and a big difference. And as I mentioned, that you're all post-residency or fellowship, so therefore the only foreign exam in undergraduate year is USMLE, which you're now beyond because you're now fellows, so you can't do a USMLE. You have to do something different, like a fellowship degree. Your institution in Pakistan, the PMC classifies various levels, and these you obviously know, but you guys are at level 4 on this particular scheme that the PMC has classified for all you guys. And that means you're a minimum of 2 years or around your FCPS post-exam and looking for post-fellowship posts. So once you do that, your options are, you can go into basic sciences. You can become a teacher in basic sciences, graduate and do a fellowship in basic sciences. The merits are promotion is easy. There's not much competition in it. And you can work in a big center in a medical school. The demerit is it is financially weaker than most clinical fields you're going to be. The other option is you can become a clinical scientist. Right, in Pakistan, you have to do diplomas, MCPS and FCPS to become one. In international, it's the same. The merit, again, is that you can become financially better than the basics. You have regular clinics. However, it's a busy life and the opportunities are not there to get. I'll tell you how to get to them in a minute, okay? You can also become a public health officer, or you can go into management, as we've already seen one of our colleagues telling you about him being a CEO. Politician is not, I've not mentioned it, but I think that's another option. Or you can go and become a teacher and start preparing young lads to become better doctors. So these are all possibilities after your FCPS exam. What you wanted to hear from me was foreign exams. So there are many foreign exams that you can do. For America, you need to have a basic knowledge. You need to do step 2, which is more difficult and you have to be matched. And once you do that exam, you get exempted from Canada, UK, Australia, and Middle East exams. And if you do PLEP, which is one for United Kingdom, then you can do that. And once you pass that, you get exempt from Ireland and other affiliated countries such as Australia, Middle East also. Okay. The MC exam for Australia is a 150 MCQ question, and it will allow you to practice there. There are a lot of fellowships that are well worth looking into, because most of my colleagues in England, they do fellowships, especially in sports and arthroplasty in Australia, which has got far better options than going anywhere else. But this is something that you have to look into, and you do the exam to get there. For Canada, is also an MCQ process. For the Middle East, you guys know better than I do, but it's a computer-based examination. And up to now, as far as I know, there is an exemption for doing exam to Ireland, but the jobs are very menial and you don't get a choice of what you want to do. And certainly there are no fellowships. And if you know what you're doing, you will be allowed to do. But if you don't know what you're doing, very little training. And I was there, but I'm sure Rehan may have a different perspective on it. He's after me anyway. Okay. So there is only one cheat code in succeeding in life, and that is research. And Masood Saab will also tell you that, this is the most important key which unlock many doors for you. If you don't do research, you don't have publications, and they're not peer-reviewed publications, you stand no chance from everybody in a foreign country. But however, if you have all these in your portfolio and your CV, then it makes life very easy for you, okay? So always publish or perish. You need to understand, nobody is going to give you a free handout for a job or a fellowship. You have to be, like I said, at least 3 to 4 times better to be equal. And what makes you better is publications. You need to work on writing in a peer-reviewed journal. And if you have publications, most of the doors will be easy to open for you. Okay, so not all roads will lead to Rome. Not of you will become a successful orthopedic surgeon, but you have to try. Okay. When you come to UK, you have to register. The licensing authority that legally allows you to practice is the GMC, okay? And by law, it is a restrictive authority which allows you to do things, but have to assess you, challenge you, and examine you, okay? This is just a slide I found the other day, and apparently of the world's biggest employers, the NHS, which is the UK, comes fourth. Apparently McDonald's has got more people employed under them than the NHS, but NHS comes there very, very close to the top, okay? The Chinese army and the US Department of Defense are obviously employing a lot more people, but the NHS is the 4th biggest employer in the world. Okay, for GMC registration, and if you want to do practice in medicine in the UK, you have to be registered. And to register GMC, there are certain guidelines, okay? The requirement for the registration is that a number of factors. Unfortunately, your nationality comes to it, and there are different rules for different people, but it is not bad. And your country of primary medical qualification has to be registered with GMC before they can accept your degree. And you need to know what type of work you will be doing and whether you have postgraduate training or not. It will make a difference in how you do the GMC. If you don't have postgraduate training, you have to do other exams. But if you have a postgraduate training, then you can actually just do the English exam and be eligible to be registered to the GMC. I think the FCPS is considered as a postgraduate exam. In additional, what you guys have been called as IMGs or international medical graduates, and you have to demonstrate the skills and knowledge that you are able to talk and speak in English, assess patients, and therefore it is vital for you guys to know and speak the language and be able to be efficient in it. However, you must understand by being registered in the GMC does not guarantee that you will find job. Okay, so you have to look for a job yourself, but the GMC is the first hurdle. If you're not a UK or an EE national, you will also need to have a visa requirement in immigration. And most of the visa immigrations and requirements are easy if you have a job to go to. If somebody has hired you or appointed you on an interview and you have that paperwork, then the GMC will expedite your registration. So you need to, before you come to UK, you need to have a job or applied for a job or have been accepted, and then you can have a visa, which is a vital must. You cannot start work, even if the GMC gives you registration, if you don't have a visa. And most people will need full registration after your stage to work in UK. And for special registration or full registration, you can come in as a junior doctor, do 2 years, and then get full registration, or you can work as a locum consultant, but provided you have the degrees, and you will get a full registration. Other than full registration, you would not get higher jobs such as fellowships and other things. They can only apply for partial medical qualification. Will give you a part registration, but you still have to have a full registration to work as a fellow. Okay, and most foreign graduates are then put in an approved practice setting, which is an NHS employer, which means there is accountability, there is validation, and there is appraisal. Okay, and this system is to make sure that people who are in the UK are protected by doctors, from the doctors. And like I said, an appropriate supervision or appraisal is needed. Most people that come to the UK work as a locum consultant, and they're not looking for other things. And that is maybe easy if you have somebody that knows you, or you are able to get yourself onto a CCT, which is a completion of certification of training, which can be done retrospectively, or which you can look at your paperwork and they will look at it and see if you can. The new thing that they call it now is certificate confirming eligibility, which is an easier option to get into for specialist registration, and that's how a fellowship can come into this country. Okay, so when you come to England and you want to work in England, the DMC will ask you to do a test to assess your international language system, which is IELTS. You can, as a doctor now, also do occupational English test, which is OET. And for that, if you're doing IELTS, you must do 4 tests: speaking, listening, reading, and writing. And a total score of 7.5 or over will allow you to get into medicine. And you must have no less than 6.5 in each of the 4 subheadings. That's IELTS. But recently, a much easier test has been introduced for people who are going into a profession or a professional job. And it's OET. This is from 2018. And the scoring system is you should not have a level B or less than that in each of the 4 subsets. And it meets the GMC requirements. The PLAB is an international doctor skill assessment test. And however, if you are being sponsored or you're going in as an overseas trainee, then you don't have to do a PLAB, you just have to do an English test. And I'm sure all you guys who've done your fellowship will be eligible for that. And if you get sponsorship from your peers in Pakistan, you can do the test, English test, and get in. So how do you fit in? Okay, so you can join after medical schools by doing IELTS, OET, and PLAB. You can be sponsored by a consultant from your country of origin, but then you have to do the English test. Most fellows are now coming through to England from the MTI, which is a training program which will not need IELTS or OETs, but will have to have an FCPS exam. The college sponsors them, and they come here for 2 years of training, and the provision is they have to go back again. They are recognized as specially trained, and they can be mediatedly interred. However, this is very difficult and is no longer possible now for people to be mediated into a specialist register. But the easiest thing is if your colleagues or your peers or your seniors, talk to their colleagues here, and through the College of Physician Surgeons, you come in for 2 years and be trained and then go back. That's the easiest option for you guys to get into this country. And most of the jobs here are hospital-based, community-based, office-based. What has happened in Brexit is that a lot of doctors that used to cross over boundaries and the channel can't come in anymore. So that makes there's a lot more options for you guys to fit into. But like I said, you need to find a peer who has a friend here who can sponsor you. If you want to work in the United Kingdom with no training, which I shouldn't be telling you, or without becoming a GP or a consultant, it is not easy and financially viable. However, this is a route that you should not go through, as you're still early part of your training and you want to go and train yourself and become a fellow. Okay. The short-term fellowship in this country are the Medical Training Initiative, which is the MTI, which the College of Physicians runs. A GMC approved sponsor, such as your consultant or your boss, who can speak to somebody here, organize a job for you, and the GMC will give you a training program, which I did in the past. I have actually got 2 or 3 guys come to see me through the POA, but I think because of the COVID, that scheme actually ran into trouble. And also the NHS advertises jobs and fellowship. You can apply to it directly from Pakistan, and you have to do an interview. And if you get selected, then the GMC process and the visa process can be easy. However, to be different, you have to do research and have a lot of other paperwork to be actually eligible to a job directly from Pakistan. Okay, there is a paper that was published recently in 2018, and it's got a guide to short-term training in UK, and it is well worth looking into it. If you go onto the web, you can find it. It says a guide to short-term training in UK, including fellowship, scholarship, and GMC sponsorships. The NHS job website in England and Wales has everything, and it will allow you to look into it, look for a job and apply for it. There is no one can stop you from applying for this job. However, like I said, you have to fulfill the criteria, tick all the boxes, then go through the interview process. And if you're successful, they will offer you a job. Most important thing is you need to explore more than what I've just told you, and you have to know what you want to do before you come here. Okay. Go and talk to your seniors and ask them. People who've done exams, have done fellowship, then come back. You need to chat to them and see if it works. Okay, you need to put everything together and decide what you want to do before you come here. I am very sorry about all the interruption, but hopefully I'm finished and I'm hopefully ready for questions now.
Thank you very much, Dr. Munawar Shah. And I'll welcome our last speaker, Dr. Rehan Gul, to let us know about the career opportunities in Ireland. We apologize for the delay as well, Dr. Rehan. Mike is with you. And
Assalamu alaikum and good evening. Thank you for the invite, Professor Umar. Thanks, Dr. Hassan, for introducing. I'm just gonna share my presentation. I think there was a brilliant talks, and I would share the same opinion with a lot of your speakers. What I would do a quick presentation. I'm sure everybody's tired of listening to all the conversations we had. So if you can hear me and you can see
yeah, we can hear you and see your screen. Yeah.
Great. I'll just minimize this here. So my name is Rehan Gul. Just to start where I'll see if that works somehow. Yeah, there you go. So my journey started with Hyderabad, which is a town about an hour and a half drive from Karachi. I graduated from Lakat Medical College, which is a university now, in 1996. For the next step, I went to Al Khan University Hospital. I did my internship and a year of residency in general surgery. And then I moved on to Ireland. Spent the rest of my time in Ireland, got a training program, Irish training program, finished the program in 2006 and moved down to Australia for my subspecialty fellowship in Adelaide in arthroplasty and sports surgery. So after spending 18 months in Australia, which was brilliant, I moved back to Ireland And that's where I'm currently based. So I'm based in Cork, which is southwest of Ireland. And for people who know Ireland, Dublin is the capital city. So I'm about 2.5 hours drive from Dublin. And I'm there as a consultant since 2008. So almost 14 years in a consultant post. That's our major trauma center, which is a level 1 trauma center in the country. We have 2 other hospitals in the same city dealing with elective stuff. The next picture is my university attachment. That's a medical college associated with the University College Cork, and that yellow building is a new state-of-the-art wet lab that we have an access to. We have a lot of industry, orthopedic industry based in Cork. So the Pewey and Stryker has plants in Ireland. And if you're familiar with Pinnacle and the Pewey make a lot of products in Ireland. My practice is I'm a high volume arthroplasty surgeon. I do sports, knees and ankles, just to keep myself busy, do a bit of a foot and ankle practice as well. And part of my commitments are trauma, so I keep busy with the lower limb trauma and periprosthetic fractures. I think just to give you a prospect, you've heard States, which is a massive country. England is massive, UK is massive as well. We're a smaller neighbor of UK. It's an independent country. It's not Northern Ireland. We're population of 5 million. We have about 21 government orthopedic units, which are called HSA in Ireland as NHS. In UK, they are based around major cities and some towns. We have 2 specialized pediatric units, 1 national spinal injury unit, 1 national pelvic and acetabular fracture unit, which are based in Dublin. And so far we have only 1 level 1 trauma center, which is based in Cork. And there's current proposal from the government to have 2 major trauma centers between Cork and Dublin. We also have 10 orthopedic units in private practice, mainly dealing with elective stuff. Now, I think you've heard the goals and what to plan, how to put the things into the prospect. So for orthopedic training in Ireland, a formal training program in trauma and orthopedics is almost 11 years till you get to a consultant post. The first 2 years, which are ST1 and ST2, is the basic surgical training. The 3rd year, most of the candidates by this time are involved in the research and their MCH projects, and they must do their basic surgical qualification, which is MRCS. As Dr. Shah already said, it's very essential to make yourself apart from other people's, and research is the main one that makes you different. So once you've done all this MCH research, MRCS, it's a very competitive post to get to the ST3, which is the 1st year resident in Ireland. And then you go through 5 years of the residency program. For Ireland, being a small country, you're not based in one hospital. You have to travel across the country to see different units, work with different peoples for various specialties. So once you've done your ST8, you're eligible for your FRCS trauma orth, which is an exit exam, and you can apply for your certificate of specialist training. The next step is the post-fellowship, post-CCT fellowship. Most of our trainees go to States, Canada, and Australia are the 3 popular spots. UK is getting popular because of the COVID. And most of the candidates do spend 1 year and 2 years in their fellowships before applying for a consultant post. So in all, about 10 to 11 years before you apply for a consultant post, and they're very competitive. Now, there is an informal training program pathway available for a lot of international medical graduates. You can apply for a formal training program, you can get it, and there are good few examples who got it. But most of the people who are international medical graduates do an informal training program, which involves SHO, which is of various time being. There are opportunities available for research and masters. So if you make yourself different and you do your MRCS exam, you have chance to get into a registrar post, and as you can lead up to a senior registrar, which is 3-4 years down the road. At that stage, you can sit for an exit exam if you may wish. And if you have completed all your requirement, you can apply for a CCST. Once you've done all this, you can still do a specialty or subspecialty fellowship and apply for a consultant post. Again, it's possible, but it's extremely competitive. Now, for trainees who are in Pakistan, in AQ or anywhere else in Pakistan, I think few options you've already heard. There's a scholarship program from HSC, which is with Irish training program, but I think it's more at a senior house officer level. So anybody who has done their FCPS, I think it's a lot of waste of time for them, and you have to come back. So if you've done your FCPS, if you have resources to do your MRCS, I think it's a better option. It's not a difficult exam. It will bypass the PLAB. It will bypass the Irish exam for medical registration if you have an MRCS, and you can work in the two countries. Now, it takes you some time to learn the system. We, in last 2 to 3 years with POA and with Professor Noor and all that, we got 2 peoples across into Ireland to see how they get on. So one was very successful, the other one didn't work out that well. But to learn the system in the country, you need time. So if you're a senior trainee and you're expecting that, look, I'm going to be lending in this country and I'll be doing everything, it takes time. So be prepared if you're coming in. Learn the system, take your time. So one option is you go through the system, complete your 4 years, do your FRCS trauma, apply for your specialist register, apply for the consultant post. Or if you have no interest in going through this long process, there are subspecialty fellowships. Now, there are limited numbers at the moment in Ireland, but they're increasing. Hopefully within a year, we'll have 2 available in Cork as well, but they're very competitive. You won't be eligible to do your FRCS trauma and ortho or a specialist register, but it's experience. So if you've done your FCPS, you want to spend some time doing arthroplasty, tumors, spine, you can learn those trades and you can return back to where you want to go back. Limitations is the medical council registration. So if during your training, if you have an access to do your MRCS, you can bypass the medical council in Ireland and GMC in UK rather than doing PLAB and all the other exams. The visas is still a problem. So as Dr. Shah said, if you have a job offer, it's much easier for you to get a visa rather than have no jobs. So I think it's considered. So at the end, I'm going to keep it short. It is competitive, but there is nothing that you can't achieve if you put your mind into it. You need to make yourself different than other people. So research is the way to make yourself different. Publications are important, and work your way through. It takes time. Sometimes it gets you frustration, but I think if you work hard, you can get through it. At the end, I would like to thank you. This is a picture from 1997 when I was an intern in Aga Khan University Hospital. That's where I started my orthopedics. And you can see a very famous person here who's co-chairing the session. And you probably know a lot of people who are in Aga Khan currently. Thank you.
Thank you very much, Dr. Rehan. And I would like to thank also Dr. Munawar. Maybe we'll have just 1 or 2 questions from you guys. First is to Dr. Munawar. I'm sure you are already doing your best to help the trainees in Pakistan directly and indirectly. But the same question I would like to ask from you is, what do you think is the best payback to your motherland? Or maybe not only from your side, but maybe you would like to add another advice for our trainees, how to approach or how much dedication you want to see from them in the application.
So I qualified from Pakistan in 1985, 86, right? I did my house job and I went, burnt all my bridges and went to the UK. Fortunately, at the time when I went in, I had an opportunity and I got into the system. However, in my defense, I had 3 papers published before I left Pakistan. And that is what made my life for me. So if I can tell you, and from one thing that you can learn from me today is write, publish, and peer-reviewed journals. And if you do that, most doors will open for you. They're not easy, but they will open for you. Now, if you can do that, I think the world's your oyster, and you can go and sort things out in any country you want to. You have to be different. I think I was told when I left that I was short, I was fat, and I had no chance unless I did publications. And if I didn't do publication, I wouldn't be good, and I need to be 5 times better to be equal. So I think I got that message, and I think you guys should get a message. And I think you should all try to write a good publication in a good journal, and that will open doors for you.
Thank you, Dr. Munawar. So I'll stress on this point as well. Now, most of our guests are international speakers. All of us as residents, we would like to do this international trainings and fellowships. So how to make yourself known at international level? It is just your research and publications. Personal relations, they do matter sometimes, but at the international level, everybody go through their publication. I was one of those who did the fellowship in USA in orthopedic oncology. Very less maybe, and alhamdulillah, very lucky to have it. But it was based on one of my publications, which Dr. Miller read and he was interested in, and then I got the contact with him. That is just to stress more on the point of Dr. Miller. Dr. Rehan Gul, I would like the same maybe questions if you can just add.
No, I think my answers are the same. Research makes a difference. As Dr. Shah said, he had 3 publications. When I went to Cork, I had my fellowship and everything, exams done. My first job in SHO, I published 4 papers in 6 months while I was in Ireland. And within 6 months, I was on the program, training program. So it makes a huge difference. Doesn't matter where you are. You can publish, I mean, nowadays you can publish everything, anything that you want, but a good quality paper makes a huge difference. A good research makes a difference. And there's so much good work been ongoing in Pakistan, whether it's Karachi, whether it's Lahore, whether it's Larkana, where you are. All you need to do is find a way to capture that and publish it. So I think that's what's important. The other thing, what's to give back to my motherland? Look, I'm available. I've come almost every year since last few years to POA. We've done live surgeries. I was in Australia. We had an opportunity to travel to different parts of the world with my fellowship supervisors to train the surgeons in their home environment. So if you can't travel for the reasons of visa, immigration, the registration, medical registrations, we have a huge faculty, a Pakistani faculty all around the world. They can travel to Pakistan and maybe scrub with you in Larkana for something that you want to do. So it's not necessary that, look, if I'm not going to go to US or UK or Ireland, I can't be trained. That training can be brought down to you guys as well. So I think there are a lot of opportunities, but it's how you guys like to use the opportunities is important.
We need to work hard for it, as also it was mentioned by the speakers, that at least you need to be 4 times as good as the one who's already in the fellowship as well. So some efforts, it's from our side as well. And one just, as an advocate for the minorities, some questions, some guys, they are asking that kindly don't forget the MS students and trainees as well. They should have maybe another pathway, or they can apply also for fellowship maybe in the near future that we can manage. Dr. Masood, I'll just mention just few points to summarize. I went through the whole chat box. I'm receiving so many messages till now. I'm trying to, keep record of these.
You're doing a great job there also.
For all the speakers, that we will share this recorded session on our YouTube channel, the Orthocon YouTube channel. I will try my best, as well as the faculty, maybe to keep an eye on your comments and your questions, even on that YouTube channel. I'll be very easily accessible. I already wrote my email. I'll write it again in the chat box for anybody who wants any help. Our all international speakers, many of them shared their emails, and those who did not in their slides also, they are happy to share their emails and speak to you. So most of your questions also can be shared there. From our Pakistan, I think The requests, I will say not maybe based on the questions, is to increase the fellowship supervisors, post-fellowship supervisors of the subspecialties. We need many people to be in these post-fellowships, so we need more fellowship supervisors for the seat in each of the fellowship in the country and abroad with collaboration with CPSP. Maybe try to involve decision makers at government level or also at the hospital for supporting the fellowship stipend. 50,000, 75,000 is less, but this is, I mean, huge, tremendous also effort by our people to help our own fellows. But we hope to see it more and increase. And also, as I mentioned previously, increase the chances for the MS research students. And one just proud category of some of the questions, is it the time to review the orthopedic curriculum in CPSP? 2 years general surgery followed by 3 years of orthopedics. Can we change that after like 2-3 decades of this training maybe? Because many countries, they require 4 years of orthopedics in Middle East and in other countries. So maybe this is the time also of our leadership and those who are in CPSP policymakers to maybe discuss this. From our international guests and speakers, maybe just 2 points. The international fellowship programs, as Dr. Miller is having in the US, this can help a lot our residents and fellows, even if they are unaccredited in that place. That will help in the global orthopedic surgery type of. And also maybe you can help with our fellowship programs in the country, if not necessarily maybe the COVID restriction, traveling, visa, all of these issues. Maybe you can help by somehow our fellowship programs in the country in Pakistan, which are running already with low budget. Dr. Masood, the mic is with you. I thank very much our speakers, all of you, and for your time, and we are very sorry for the delay.
Well, thank you, Dr. Wada, for doing such a wonderful job at moderating this almost 3-hour session. I think we are beyond 3 hours now. I think 3 hours, 20 minutes. But anyhow, I hope the participants have had some good, strong take-home messages from our effort. We may have crowded the session a bit, but I thought my idea was to give you a perspective which is more global as well as local. So we had some Pakistani speakers, we had some American speakers, and we had some couple from British and Ireland area. And what we are missing actually now is the Asia Pacific region and Canada, which are also big avenues, inshallah, which we will try to cover in the next session if time allows and if we have sufficient energy left to compile another such session. And I see the attendance was great till half an hour ago. We had more than 100 plus participants staying with us throughout the last 3 hours. And obviously a big thank to my faculty members who stood with us and gave their open-hearted opinions and experiences, especially personal experiences. A lot to learn from personal experiences. And I'm sure we will be able to put all this on a YouTube Orthocon channel, and you can refer back to it anytime you want. But so much so for the take home. I must thank also our secretaries who've been sitting with me throughout the session, Aziz and Sharif Charania. You can't see them, but they are here with us. They've had their dinner. I'm yet to have my dinner. So anyhow, but so great sacrifice and effort from them also to manage the session in the background. And lastly, thank you for the Orthocon scientific chair, Dr. Harun, Dr. Yasser, and the other scientific committee members for giving their input and making this into a very successful program. I must thank all my colleagues, faculty members again for giving their input. I'm sure all the participants have had some good learning experience today. So I think, Dr. Bada, with your permission, we can conclude and say goodbye to everybody in Pakistan, in USA, and in in UK. So before that, Sharif tells me we need a group photo. So everybody put their videos on, cameras on, and we can take a group photo. Please, I request all the participants to put their cameras on. We can take a big group photo now. जितने भी लोग रह गए हैं, faculty members, colleagues, students, residents. I see my own colleagues staying with me. Dr. Shahryar, thank you. Dr. Akbar, Tashfeen Saab, thank you very much. Staying together. Saad, another pivotal person behind the organization itself, and Orthocon. Thank you, Saad, for staying over time. Is that the whole thing? Saad, can you take Sharif, aap le rahe? Yeah. So everybody smile, please. All right. So Dr. Naveed also good. Dr. Arun Saab joined. I think he is not here now, but he was one of the first to join. Sharif, are we done? और वो साथ साथ वो फीडबैक फॉर्म भी भर दें, तो जो भरेंगे उनको सर्टिफिकेट्स ऑफ पार्टिसिपेशन मिल जाएंगे, साथ वो सर्कुलेट कर देंगे आपको. आप साथ से पूछ लें, शरीफ से पूछ लें, फीडबैक अपना, क्वेश्चंस कमेंट्स तो आते रहे, लेकिन फीडबैक भी दें, हाउ कैन वी इम्प्रूव द प्रोग्राम, एंड इंशाल्लाह जो एडिशनल चीज़ें आपको चाहिए वो ज़रूर बताएं. ओके, थैंक यू एंड गुड बाय. अस्सलाम वालेकुम, अल्लाह हाफिज़.